Urgent. The WHO warns of global chikungunya virus outbreak. Mosquito-borne epidemic spreading. Imagine a world where a single mosquito bite can leave you debilitated for years, with no cure in sight. This is the harsh reality of the chikungunya virus, a mosquito-borne disease that has been wreaking havoc across the globe for decades. The World Health Organization, WHO, has sounded the alarm, warning of a potential repeat of the 2004-2005 epidemic that affected nearly 500,000 people worldwide. But here's where it gets concerning. The current surge, which began in early 2025, is spreading rapidly across the Indian Ocean region, Europe, and other continents, putting an estimated 5.6 billion people at risk. Dr. Diana Rojas Alvarez, a medical officer at the WHO, drew a stark parallel to the past epidemic, saying, "We are seeing history repeating itself." The current outbreak has already infected an estimated 1/3 of La Réunion's population, with cases also reported in Madagascar, Somalia, Kenya, and Southeast Asia, including India. But what's particularly alarming is the increasing number of imported cases and recent local transmission within Europe. In continental France alone, there have been approximately 800 imported chikungunya cases since May 1st, with 12 local transmission episodes detected in several southern French regions. A case was also detected in Italy last week. So what makes chikungunya so concerning? For starters, there's no specific treatment for the virus, which is spread primarily by Aedes mosquito species, including the infamous tiger mosquito that also transmits dengue and Zika. These mosquitoes bite during the daytime, making it crucial to take preventative measures, such as using insect repellent and wearing long-sleeve clothing. The WHO is urging action to prevent a repeat of the past epidemic, but the question remains, are we doing enough to combat this growing threat? What do you think? Should governments and health organizations be doing more to prevent the spread of chikungunya? Share your thoughts in the comments below. WHO raises concern over chikungunya virus spread, a global threat. The World Health Organization, the WHO, has raised a significant alarm regarding the resurgence of the chikungunya virus, a mosquito-borne illness that wreaked havoc globally 2 decades ago. This warning comes as new outbreaks, particularly originating from the Indian Ocean region, are beginning to spread to Europe and other parts of the world. As of now, approximately 5.6 billion individuals reside in areas across 119 countries that are at risk of contracting this virus, which is known to cause severe symptoms such as high fever, debilitating joint pain, and even long-term disabilities. Diana Rojas Alvarez, a medical officer at the WHO, shared these alarming statistics during a press briefing in Geneva, emphasizing the urgent need for preventive measures. "We are witnessing a troubling repetition of history," Rojas Alvarez stated, drawing a stark comparison to the chikungunya epidemic of 2004 to 2005, which impacted nearly 500,000 people, particularly in small island territories, before it spread globally. The current wave of infections began in early 2025, with significant outbreaks reported in the same Indian Ocean islands that were previously affected, including La Réunion, Mayotte, and Mauritius. Shockingly, it is estimated that about 1/3 of La Réunion's population has already been infected. The virus is now making its way to countries like Madagascar, Somalia, and Kenya, and has also shown signs of epidemic transmission in Southeast Asia, particularly in India. What is particularly alarming is the rising number of imported cases and the recent instances of local transmission within Europe. Since May 1st, there have been around 800 reported cases of chikungunya in continental France. Furthermore, 12 local transmission events have been identified in various southern regions of France, indicating that individuals have contracted the virus from local mosquitoes without having traveled to areas where the virus is endemic. A case was also confirmed last week in Italy, raising further concerns. Chikungunya, which currently has no specific treatment available, is primarily transmitted by Aedes mosquito species, including the notorious tiger mosquito, which is also responsible for spreading dengue and Zika viruses. The potential for rapid and extensive outbreaks is high, especially since these mosquitoes are active during the daytime. Therefore, prevention is crucial. Individuals are advised to use insect repellent and wear long-sleeve clothing to protect themselves from bites. As we navigate this concerning situation, it raises important questions. Are we doing enough to prepare for and prevent the spread of such diseases? What measures can be taken to protect vulnerable populations? We invite you to share your thoughts and opinions in the comments below. Let's discuss how we can collectively address this pressing public health issue. WHO warns of global chikungunya outbreak risk. Imagine a world where a little-known virus suddenly becomes a global threat. That's the alarming reality the World Health Organization, WHO, is warning us about with the chikungunya virus. This mosquito-borne illness, which causes fever and severe joint pain, is on the verge of a major outbreak, and it's something we all need to take seriously. The WHO has issued a stark warning. The signs of a potential global epidemic are eerily similar to those seen 2 decades ago. Back then, a major outbreak swept across the Indian Ocean, affecting nearly 500,000 people. The virus didn't stop there. It spread globally, leaving a trail of debilitating symptoms, and in some cases, death. But here's where it gets controversial. While chikungunya might not be a household name, it has already been detected in 119 countries, putting a staggering 5.6 billion people at risk. This means that almost 3/4 of the world's population could be affected if we don't act swiftly. Diana Rojas Alvarez from the WHO highlighted the urgency of the situation. She recalled the 2004-2005 epidemic, which started in small island territories before spreading worldwide. Today, the same pattern is emerging. Since the beginning of 2025, major outbreaks have been reported in Reunion, Mayotte, and Mauritius. In Reunion alone, 1/3 of the population is estimated to have been infected. And this is the part most people miss. The symptoms of chikungunya are similar to those of dengue fever and Zika virus disease, making it difficult to diagnose. This means that many cases might go unnoticed until it's too late. The virus is now spreading to other regions, including Madagascar, Somalia, Kenya, and even parts of South Asia. In Europe, imported cases have been reported, with local transmission in France and suspected cases in Italy. The WHO is urging countries to take immediate action to prevent history from repeating itself, while the case fatality rate is less than 1%. When you start counting billions of cases, that 1% can translate into thousands of deaths. The organization is raising the alarm early so that countries can prepare, detect, and strengthen their capacities to avoid large-scale outbreaks. One of the most concerning aspects is the role of climate change. The tiger mosquito, one of the primary carriers of the chikungunya virus, is venturing farther north as the world warms. These mosquitoes bite primarily during daylight hours, with peak activity often in the early morning and late afternoon. This makes prevention even more challenging. The WHO advises people to protect themselves by using mosquito repellent and ensuring that water does not stagnate in containers, like buckets, where mosquitoes can breed. But is this enough? Some might argue that more drastic measures are needed to combat this growing threat. So what do you think? Is the WHO's warning enough to spur global action? Or are we headed for another devastating outbreak? Share your thoughts in the comments below. Let's discuss how we can better prepare and protect ourselves from this looming threat.